Welcome everyone to Navigating the Path to Certified Health IT under new CMS requirements in 2024. My name is Lynn and I'm the Campaign and Field Marketing Manager at Drummond Group, and I'm here with Bob Bryan, Drummond's Senior Director of Advisory Services, and Sonia Galvin, Drummond's Senior Director of Health IT Testing and Certification. Sonia and Bob are going to cover everything you need to know about the CMS promoting interoperability requirements for ONC-Certified EHR Technology. I encourage you to engage with us throughout the webinar using the audience chat function on the right-hand side of your screen. If you have a question, just pop it in that chat so Sonia and Bob can answer it during the Q&A period at the end of their presentation. I'm going to pass it over to Bob and Sonia now.
Hi, everyone. Welcome to our webinar today. We're looking forward to talking about what CMS has done recently and how that fits in with ONC requirements for certification. And I'm here with Sonia Galvin, as Lynn mentioned. Hi, Sonia.
Hi, good morning, everyone.
So it's great to have everyone here. Wanted to start this morning by just giving you a quick view of what our agenda is. As Lynn mentioned, Sonia is the Senior Director for Health IT Testing and Certification. They manage the certification process for our customers. I'm the Director of Advisory Services, and in Advisory Services, I like to say that we help customers through the journey to certification, all of the details and requirements that you need to meet to be ready for certification, providing you with a subject matter expert to help carry you through that process, both before certification and after certification. So we're here today primarily to focus on recent changes with CMS that have affected certain specialty EHRs that have possibly not been certified in the past, some that may have been partially certified and that also want to get up to a level to assure that their customers are qualified for the CMS MIPS program. So I'll be talking about that MIPS program and what we've learned recently about the changes that will affect EHRs and their customers. We'll start out with just kind of an introduction to Drummond, because I think we have some people on that may have not been exposed at all to Drummond or the certification process itself. And then I'll give you somewhat of an overview of U.S. health IT regulation. I think it's important to understand how these agencies and all the acronyms that are involved with them kind of fit together in the regulatory structure that affects both EHRs and your customers. And we may even have some clinician customers on today, so hopefully this information is also helpful to you if you're a healthcare provider, clinician, as we talk through the CMS program and how it directly affects clinicians. So that's really the third topic we'll get to. I'll talk about what changes have come for 2024 in the CMS MIPS program, and specifically the changes that are affecting some specialty areas in the MIPS program, which is the reimbursement program that CMS does for healthcare services provided to Medicare patients. And then Sonia will be able to walk you through the testing and certification process, how that works, what it means for you. And then lastly, we'll talk a little bit about how Drummond can support you in that process. So hopefully that's helpful as an agenda. And as Lynn mentioned, if you do have questions coming up, while we're in the presentation, please feel free to put those in while we're going through the presentation. We'll pick them up at the end, but anything you think of or hear that we're discussing that you want us to clarify, please go ahead and enter those questions. All right, So let me just quickly tell you a little bit about the Drummond Group. So we've been in interoperability, security, and compliance testing for 25 years. We started out in the AS2 space way back in the early or late 90s, actually, early 2000s. And in the 2010s, we moved much more into healthcare. We continue in those other areas, but we've been very active in the healthcare IT space in the 2010s, particularly with the legislation that has come at the federal level since then. We're typically working with highly regulated industries, health IT being the one that we'll be talking about today. And for certification process, our brand is well known, so it has become the certification brand that many customers rely on and include on their websites to give their customers an assurance that their products are up to the levels that they need to be. That's a high-level introduction to what we do, but let me just tell you a little bit more about some specific areas. So specifically for certification programs, ONC Health IT, which we'll be talking about today, is a key area that we work in, and Sonia's team does the certifications in that space for customers, specifically for health IT EHR customers. But beyond that, we also heavily work in the fire space. It plays into ONC Health IT certification, and it also affects other players in the healthcare industry, particularly payers. And we have a program specifically for payers that provides certification to fire interoperability requirements. And actually, it's worth noting that CMS just released their final rule affecting payers for prior authorization. Probably doesn't directly affect the people on this call, but it will be coming into play as those fire capabilities get built out on the payer side to electronically manage prior authorization transactions. Clinicians and the EHR technology that they use will be on the other side of that prior authorization use case. We also work in the other areas mentioned on this slide. We have a pediatric health IT certification, and then we work in a number of other standard spaces. And one I would particularly note here is the DEA EPCS drug security space, where we've been actively involved in security for supply chain management in the pharma space. Lastly, it's important to mention that we also have a team that focuses more heavily on privacy and security. So we do HIPAA compliance work, and we do other security work outside of the healthcare space. And it's important for us as a company that's actively involved across healthcare that we continue to have deeper expertise, particularly on privacy and security, that our customers can access. So that's just kind of an overview of everything we're involved in. Now let's dig in particularly to the health IT topics that we plan to get into today. So as I mentioned, I wanted to kind of give you a quick overview of health IT regulation as context for what the key agencies, CMS and ONC, are doing that affect your worlds as EHR developers. So I'm sure that everyone on this call is familiar with HIPAA. It was enacted back early 2000s, and it is kind of the umbrella framework over everything that these agencies are doing from a regulatory perspective. Kind of all starts with HIPAA. So these two agencies that we're going to be talking about today, ONC and CMS, both have regulations that they've implemented under the umbrella of HIPAA. Key difference between the functions of these two agencies. So ONC is the Office of the National Coordinator for Health Information Technology. They set requirements for software developers in healthcare. Their programs generally are voluntary in the sense that the ONC isn't directly requiring EHRs to certify to the requirements that they set in their regulations. However, CMS, which manages Medicare and Medicaid, they set requirements for providers and clinicians to get reimbursed for Medicare services that they're providing to patients. So those because they require the use of certified technology that's provided by software developers, the requirements that CMS sets affect what software developers need to do. And it affects the decisions that software developers need to make to get certified. So in simple terms, CMS creates a customer requirement that gets pushed to software developers to be certified, and specifically, the term that's commonly used is CEHRT, Certified EHR Technology, sometimes called CERT. So when you see that term, it's really coming from CMS because CMS is requiring its providers to use certified EHR technology. And that leads to health IT developers making the choice to become certified. And the last thing to understand about this is that much of this regulation is being driven by both agencies, and HIPAA requirements focus on the need to promote data interoperability or sharing of healthcare data amongst a whole bunch of different use cases that apply in this space. Sometimes simply enabling patients to get access to their own data, other times enabling providers to share the data between themselves, also sharing with payers, and then other research-related use cases. I'll stop for a minute there. Sonia, anything else that you might comment on about this?
Yeah, you were probably reading my mind. So one thing I thought of, although CMS and ONC have worked closely together, there are also other organizations that require ONC certification. At one time, I know JCHO was also requiring certified software by the ONC program. Additionally, whether it's like state Medicaid programs or just some other state initiatives that we've been finding out from clients, different states are requiring certified software. So a lot of benefit to getting the ONC certification, even outside of any CMS incentives.
Yeah, that's a really good point you make about the state programs because in the work that our advisory team does, it's very common for us to hear state requirements coming up, particularly from states like California, Utah, Illinois, Maryland, I think there are some others out there too. So they're jumping on these same requirements because they meet the policy goals that states will want to see satisfied, just as the federal government wants to see certain policy goals around enabling better patient access, better provider access to healthcare data to improve care. So hopefully it's a hand-in-glove relationship, and it's all of those requirements, federal and state, that are bringing EHRs to the table to become certified at this point. So just to talk a little bit more about promoting interoperability and what it means, because this promoting interoperability term, we'll get into it a little bit more on the CMS side of the discussion. But I wanted to just talk a bit about what this means from a functional perspective. What capabilities EHR software developers are being asked to include in their solutions. So one key area is a specific set of data that this program wants to see included in health IT solutions, patient demographic and clinical health information. Kind of goes without saying that you have that information in your solutions now, but in the program, a lot of it has to do with having that information and data comply with standards so that when it's shared between solutions, both sides can understand the data and use it. Specific technical capabilities that the program focuses on. We've talked a lot already about information sharing. That obviously is a key goal, but you can't share information without privacy and security around it, because we all know the privacy and security requirements that come out of HIPAA for healthcare data. So that PHI needs to be handled properly when it is shared. Clinical decision support is another function that's important to this program because it affects care quality. And that clinical decision support is a much longer discussion, but key thing I would say about it is, and many people probably already understand this particular capability, but it has to do with making external research and more support available to doctors through their health IT solutions. Physician order entry is another area, common feature in health IT. And then lastly, healthcare quality management in general. And particularly CMS is the largest payer, cares about the quality of the care that's being delivered to their customers. So management of quality metrics and measures is also a key aspect of the program. So those kind of high-level areas are all brought down into regulations that have very detailed requirements. And those regulations, you'll hear us talk about certification criteria, and Sonia will get into more about that. But the details of what's needed on these particular topic areas is all laid out in the certification criteria, which are in the regulations that have been adopted by the ONC. Sonia, anything else on this that I missed or that you wanted to comment on?
I think you covered it very well, but I'll just add that while this is the focus, we do still work with developers who have more modular products. So some of the technical capabilities that you list here may not apply to certain modules, but nonetheless, they are still able to get certified under the ONC program.
Yeah, that's a really good point, because I know we often work with developers, and when they're deciding if they want to natively develop certain capabilities, they do have choices as to whether they'll rely upon third-party software that may already be certified. And there are some particular areas like e-prescribing that commonly a choice is made to leverage a third-party solution, either on a white label basis or by simply making it available to their customers. And we often help customers or EHRs work through those choices in terms of strategically whether they want to use a third-party solution or build it themselves. So that's an important area in terms of how you want to skin the cat for certification, whether you want to do it all yourself or bring in some third-party capabilities that are already built. All right, so let's get into a little bit about the CMS MIPS program, because this is a key part of what we wanted to talk about today. As many people already know, so the CMS MIPS program, and there are some other acronyms around these reimbursement programs that CMS has, but it all comes down to how CMS reimburses clinicians for the work that they do for Medicare patients. And those reimbursements are affected by whether or not certified technology is being used by the clinician. And they're affected by other factors as well. So what's happened in 2024? Going into this year, there were a number of practice areas that previously have not been required to use certified technology. And a couple, and we have the list up on this slide. Physical therapy is a big one, and occupational therapy, which often plays in with physical therapy and may be included in the same types of specialized EHR solutions. And then clinical psychology, which plays into the behavioral health space. So I know that different EHRs specialize in different ways and may cover a number of these categories of clinicians. But the key thing is there were exemptions from using certified technology for these areas in 2023 and before that. Those exemptions have gone away. And we'll talk a little bit about the scoring methodology in a minute here. But a few things to note about this. There was another change in 2024 to require at least 180 days of meaningful use of certified technology by clinicians. This used to be a 90-day requirement. So particularly for EHRs that are now looking at getting into the certification process, you need to be aware that this level of use in 2024 is being required by CMS. And there are some nuances to how that works, which are beyond our discussion today, but it's important to keep that 180-day requirement in mind. Also, just wanted to comment on clinical quality measures. There are some specific measures that CMS wants to look at as part of their program relating to the quality of care, specific measures for different clinical areas. And Sonia, I know you've worked with customers on those measures in the past. Any comments from you about that?
Yeah, so any developer who's new to the certification program may also want to take a look at the clinical quality measure criteria, which is C1 through C3. So CQMs, they are measures that are in a specified format, and it's based on data that's derived from the health IT module just to help measure the quality of healthcare. So very important. It is a requirement under the CMS program. And so again, it's criteria C1 through C3 with an optional C4. So really important to take that into consideration.
Thanks. And the last note here is that small practices do remain exempt. It's under that base level of 15 clinicians. The thing to keep in mind, of course, is that if your solution may extend to some customers that are over that 15 clinician level, or if you expect to grow into a space that would put you above that, or some of your customers above that number of 15, you should be looking into certification. So what does that mean? What does certification mean in 2024 for these new practice areas? So in 2023, what CMS was doing was reweighting the way they handled the MIPS program. And as you can see here, the promoting interoperability component was reweighted in the past to 0%. so that 100% was spread across these other three categories. And this promoting interoperability component is where CMS says you need to use certified technology, and you need to attest to that as a clinician, that you're using certified technology in managing your patients. So that reweighting is going away in 2024, and as you can see, it is taking these additional practice areas to the traditional weighting that's applied to most of the rest of the industry for a while. And it puts this 25% weighting for MIPS scoring back in for these specialty areas that had an exemption up until now. So that's the big change. It affects generally, while the scoring methodology is kind of complicated, basically it can be a disincentive or an incentive, plus or minus 9%, I think roughly, is what providers are looking at on the payments that they would receive from CMS for Medicare work. So that can be a significant impact for providers and clinicians that are already squeezed in various ways. So the lack of being able to attest to the use of certified technology will end up potentially creating disincentives and the inability to reach those enhanced incentives that can be available for providers that fully meet the requirements of the program. So that's the financial upside downside for providers. With that, I will pass it over to Sonia to talk about the testing and certification process and how you move ahead with that in order to enable your provider customers to actually take full advantage of what's available from CMS. So over to you, Sonia.
Thank you, Bob. So I just want to give an overview of the Drummond Group Test Lab and Certification Body. First of all, we are a separate business unit from Bob's team, which is the advisory team. As he mentioned, his team guides you through that journey towards testing and certification. So for our processes, it's the actual test event and certification review. Next slide, please. Thank you. So Drummond is a leader in ONC Health IT testing and certification. We do work closely with the ONC in order to help developers meet just a rigorous and continual compliance requirements. Our Drummond Test Lab is authorized by the ONC to conduct the test events and also accredited by NAVLab. We do offer something a little bit different from our competitors, as our developers will be assigned dedicated test proctors. So our test proctors are well versed in all of the ONC criteria. So there's not a need to transition from person to person. And as a value add, our test lab does provide technical support prior to, during, but even after testing. So we continue to provide that customer support and serve as a technical resource when there's new criteria release, such as we just had in HTI-1 in December. Or if your software were to undergo any changes, our test lab, our proctors will be able to assist you. Also, our certification body, authorized by the ONC and accredited by ANAB. And so in order to certify health IT products, currently, if you were to look at the ONC Chapel website, over 75% of the products are Drummond certified. So we've been in the program for a very long time, well, actually since its inception. We certainly take great pride in helping developers ensure they meet compliance. Next slide, please.
Yeah, and I was just going to comment here, Sonia, that that Chapel website that you mentioned, that's where clinicians actually pull down a certification ID by selecting the technology that they use. So if EHRs have their technology showing on that website with the certification criteria that are required, then that enables their providers to pull down the certification ID that they need to submit to CMS to show that they're using the right technology.
That is correct. Yes, very important point. All right, so now we'll just take a high-level overview of what the testing and certification process looks like. So just to begin with, we do have an enrollment process, which includes requesting our Drummond criteria selection framework. So this part is important because it does help developers identify and select criteria. While developers have the exclusive obligation to select this criteria to test, this is just a framework to aid in that process. We also offer a call with our client services team and a technical resource to get the process started, answer any questions you have. Once enrollment is complete, then our developers, again, are assigned a dedicated test proctor. So that proctor is a resource to ask technical questions prior to testing. It's the same person who's going to be actually testing the product. And so during the test event, the proctor will provide a meeting link and actually record the test event session. That recording, along with any test files, test tool validations, those are then passed over to our certification team for review once all testing is completed. So the certification body reviews all the test artifacts, and if everything is in order, the certification will be approved. Certificate is issued. Developers are notified by email with certificate and other just important post-certification requirements. So the support doesn't end there. Again, this is an ongoing compliance requirement. And so we'll talk about that in just a moment. Next slide, please.
Yeah, and I was also going to mention, Sonia, that the certification body has a really helpful document, a decision guide that's available on the website.
Right.
And do you want to just talk a minute about that decision guide?
Yeah, so that's what the criteria selection framework is a part of. In total, it's called the decision guide. So that is available through our website. And so we will provide that to any of our prospective clients. Again, it helps highlight which criteria to select, what may be applicable to your product, what's required under the ONC-based definition, what's required under the CMS CEHRT definition. It also gives some insight into the criteria itself, maybe how long it takes to test, things like that, in order to help developers plan out their test days. And then once the call with the client services team is scheduled, that kind of information will be outlined and give prospective clients an opportunity to ask any questions about that criteria selection.
Great. Yeah, that's a really good resource, and I do recommend that EHRs getting started in this process go to the website and download that.
Yeah, thank you. Thanks, Bob. So we'll talk a little bit more about the testing process. So currently there are 53 total ONC criteria. 24 of those are designated as live testing. And so as noted earlier, Drummond does provide clients that aid, again, selecting the criteria, but it's up to each developer to determine which criteria to select. And so the test event can be scheduled in a half day or full day session. Now, if there are any issues encountered during the test day, the test proctor will make you aware of that. And if additional time is needed to rectify any issues, a free 2-hour retest is available for initial certifications. Certainly is something helpful to clients. And then aside from the 24 criteria that are live tested, the remaining criteria are self-tested. And so that means that developers will use the ONC requirements to determine on their own when their products meet compliance. And so to do that, there is a Drummond attestation form that's provided. So developers will complete that form, fill out all the necessary information about the Health IT product, and then our certification body will review that and grant certification. Technical assistance is still available even for that self-tested criteria. We know that there are questions about meeting the requirements, so our team is certainly available for that.
Yeah, and it's important to understand that those criteria that where you don't have to do live testing, the attestation is still very important. It's essentially a developer's representation to the ONC that it fully complies with the requirements of a criterion. But
Yeah, and then to add to that, any artifacts that the developer has in determining that they have met compliance, those artifacts should be maintained by the developer in the event that they may be asked for that in the future. So the ONC does talk about record retention additionally in their final rule. So very important. So yes, thank you for highlighting that point.
Yeah, it's basically the audit record that you've got to maintain to
Essentially.
show the basis for your attestation to the government.
Right, absolutely. All right, so these are some post-certification requirements that the ONC requires after certification and after your testing is completed. So this chart, this shows the conditions of certification, just as an example. So these were established by the ONC, and these are required to be met in order to maintain an active certification. So, for example, the information blocking. That applies to all health IT developers and even providers and some other actors. I'm sure most of you have already heard about information blocking as developers prohibited from taking any action that would constitute any information blocking of patient data. So this serves as an example of where Drummond helps developers staying informed about these types of regulations. And so very important, again, partnering in that compliance requirements.
Yeah, it's really kind of the flip side of interoperability. I mean, all these interoperability requirements are basically saying you got to be able to share data.
Mm-hmm.
But the flip side is if you're not effectively sharing,
Mm-hmm.
there are regulatory steps that can be taken against you to essentially enforce the requirements that you make information available and don't block.
Right. Yes, it's very important information blocking. And so going on further for real world testing. So that involves developers self-testing their product in the field and providing attestations and specific reporting requirements to their certification body. So this particular condition, it's only applicable to certain criteria. And then we also have API conditions, which again, applicable only to a subset of criteria. Assurances, communications, attestations which are done on a semi-annual basis. So those apply to all health IT developers. Now, we do have a new condition of certification, Insights, which was finalized as part of the HTI-1 final rule. So this one is going to start a little bit later. Data collection doesn't start until 2026. And so ONC is using an incremental approach for that. First, only requiring developers who have 50 hospital sites or 500 clinician users as clients. And then lastly here, we do have the quarterly attestation. I think that it might have cut off on the screen there, but there is a quarterly attestation. So developers are required to submit that to their certification body. So Drummond enables this by providing developers an electronic attestation form via our customer portal. And that quarterly attestation is a requirement. It focuses on any changes made to the certified product for the previous quarter. But there's also other information concerning the health IT product, maybe like a version change, things like that are addressed through the quarterly attestation process.
Yeah, and it's we're commonly on the advisory side working with customers both who are both on the journey to certification and customers who are continuing to manage their certifications properly with the certification body, including responding to changes in the certification program, such as the recent HTI-1 final rule that is effective as of February 8th, so just a couple weeks from now.
Right. So it's just important to know that even after the test event, after certification is issued, there is still work to be done. And again, that's where Drummond is a partner in compliance and making sure that developers stay on track. So I'll go ahead and pass it back over to you, Bob.
Thanks. That was a great overview. And we have a few questions. Just want to talk briefly about how Drummond supports customers in the certification process. Sonia talked about a number of things that the certification body does, kind of starting with that decision guide and moving into the support that proctors give and that the portal provides to customers that get into the certification program. On the advisory team side, we're really guiding customers through that journey. So we work very closely with development teams. We have subject matter experts who are deep in requirements analysis and understand all of the capabilities required for certification. They're helping with planning. They're training teams on the program, both on the compliance side of companies as well as product management and development. We can help, getting into the details of specific certification criteria and the standards guides that sit behind many of those criteria. We build some specific development support tools to help accelerate the process for our customers, and then continue to provide testing support and troubleshooting through the development process, and also kind of longer term strategy and planning for product roadmaps as they look at the requirements they're trying to meet for certification versus other features that they're trying to incorporate, and sometimes the intertwinement between things that customers are trying to provide to their customers that may be affected by certification requirements. With that, we do have a couple questions that have come in. One I see, there was a question about what happens when state regulations conflict with federal regulations and what takes precedence. That's typically federal regulations take precedence over state regulations, although that's a little bit more of a legal question. And we haven't seen that come up as much. Typically, states are kind of piggybacking. We did see a situation in California with one data version, US CDI version 2, being required earlier than the federal government was requiring. But what was good is that the federal government had enabled developers to move to that version through a program called SVAP, even though it wasn't being specifically required by the federal government at that time. Sonia, have you seen this one come up?
I actually haven't. Mostly we're being focused on the ONC program, but I'd be really interested to hear the example. So if we can have more information about that, I'd love to get back to that client.
There's also a question about how long it takes to get certified. And a lot of customers ask me this, and it really depends. It depends on where your solution is today. Mm-hmm. And many solutions that we see already satisfy many of the requirements, and we're involved in doing gap analysis with them on what they meet and what they need to add to their solutions. But one example is that there's a whole set of criteria around privacy and security, the D criteria, and many solutions already have much of that satisfied because you're already HIPAA compliant and you've been working hard on that. That's kind of and then it also affects it's affected by whether you may choose third-party solutions.
Yeah.
If you choose, yeah, go ahead, Sonia.
Yeah. So just to kind of piggyback what you're saying, it can vary by developer. So we have some developers who come to us who are just very well advanced in their developments, pretty much ready to go. They've already reviewed the ONC requirements, understand what needs to be done. So in a case like that, typically it's a matter of scheduling, meeting with the test proctor, having that introductory call. So it's highly dependent on the developer. If they were to, it really just depends on what their schedule is. We could schedule a test event. Once a test event is completed, then the certification review typically takes about 2 weeks after that to get finalized. So Drummond right now, we do have availability for February, March, even some dates open in January. So it really depends on the developer. It could take a month to complete it, and some developers it could just take them 6 months because they like to take advantage of some of the pre-test support that we provide, get some questions answered first before they go finish the development. So it's really dependent on the developer.
Yeah, and we always recommend for new EHRs coming into this process that they work with us on a very early assessment of where their product is, because then that can drive a good plan, a development schedule to get to the finish line on what you want to certify to. There's also a question about whether CMS would be giving exemptions or hardship exceptions. I know that's come up in the past. We don't know for sure, but what we've seen is that that CMS seems to be tightening up on that. So I mean, they definitely have announced that they expect 180 days of meaningful use. I would say that there's going to need to be clear indications of hardships and a justification for an exception. I wouldn't expect that to be granted on a blanket basis as we go into this year, but it really remains to be seen. So we'll know more.
Bob, I'll also add some developers may not be certified at the start of the reporting period, and so ONC in the past has allowed clinicians to use a product that wasn't certified as long as it gets certified before the end of the reporting period. Nothing in the functionality has changed, so that is a possibility if the product isn't fully certified yet.
So am I right in understanding that they've expected that the certified capabilities be there in use?
Yes.
Just the process of getting them certified might not be finished.
That is correct.
Yeah.
Yes.
Well, with that, we've come to the end of our time. Lynn, any further comments from you?
Yeah, we just want to thank everyone who attended today for taking the time out of your busy days. You're going to receive a copy of this recording via email along with some other helpful resources. But also, if you have some more questions for Bob, you can scan that QR code on the screen there, and that will book you a free consultation, a free health IT consultation. Or you can contact us at the 2 email addresses you see on the screen as well. Everyone, have a wonderful day, and we look forward to seeing you at the next webinar.
Thanks, everyone.